Hello, and thank you for listening to this Insights Brief on reducing Medicaid churn and revenue retention strategies. I am Jennifer Forster, Director of Medicaid Strategy at Eliza, an HMS company. Today, I would like to share with you Eliza's approach for engaging Medicaid members to ensure continuity of coverage, thereby improving financial and clinical outcomes. Medicaid churn is the term used to describe the unnecessary administrative disruption of healthcare coverage, resulting in the cycling on and off of the Medicaid program throughout the year. As one researcher put it, Medicaid enrollment is like a leaky sieve. Every year, millions of people enroll, only to subsequently lose their coverage despite still being eligible because of inefficient and cumbersome paperwork requirements. Churn is the result of incorrect mailing addresses, confusion navigating the system, limited access to assistance or means to renew, unpaid premium payments, missed deadlines due to busy lives, and in some states, work requirements. Whatever the reason, impacts on members and health plans are significant. Members who churn are likely to experience worsening health due to limited access to providers, services, and medications. When an individual is uninsured, preventive care is likely to go by the wayside, and management of chronic conditions falters, resulting in gaps in care, increased ED utilization, and a higher chance of expensive inpatient hospitalizations. Churn affects all departments across health plans, from clinical to quality to marketing and operations. Administrative expenses associated with re-enrolling members include welcome and onboarding costs, such as ID cards, welcome packets, PCP assignment, and welcome calls. Plans have estimated this to be about $100 per member. From a quality perspective, members that do not meet the continuous enrollment criteria cannot be included in the HEDIS denominator, reducing the plan's ability to measure and track quality improvement over time. This also means that all the hard work plans put into reminding members to close gaps in care goes unrecognized, potentially affecting quality scores. Research has shown that medical expense goes down with the number of months enrolled. As you can see here, the average cost of an adult member in the first month of enrollment is $705, and by month 12, it goes down to $326. The more churn in the membership, the higher the medical expense because the plan's never getting out of those initial higher cost months. Eliza's retention programs address churn related to loss of coverage due to missed renewal periods, work requirements, and premium payments. We partner with health plans to proactively remind Medicaid enrollees that they're coming up on their renewal period and provide clear direction on how to renew their coverage. Medicaid MCOs have had great success with our multi-touch, multi-channel approach, which has been effective in improving retention by 10 to 18% compared with those not engaged. The addition of Medicaid work requirements, premium payments, and lockout provisions for noncompliance will augment the need for retention efforts throughout the year to prevent any lapse of coverage. Eliza is able to notify affected members about work requirements and provide education on how to maintain coverage by going through the state attestation process. Similarly, in those states that require premium payments, Eliza can help members understand what costs they're responsible for and remind them when payments are due in order to ensure they stay covered. We have found that a multi-channel, multimodal approach works best in getting members to take action, as illustrated on the chart in the bottom right-hand portion of this slide. Members who only received a letter from the state notifying them of their renewal date had a 50.6% retention rate. This increased by 4% when the member received two touches, a letter from the state and an automated call, letter, or email from the plan. The retention rate went up to 57% when the member received three outreaches, a state letter, a plan letter, and an automated call or email from the plan. Finally, I want to share with you a case study. We did a financial impact analysis on a retention program we ran for a mid-sized health plan that serves Medicaid and D-SNP members. Those that Eliza outreached had an overall 28% higher rate of retention than members that did not get the Eliza outreach. Based on our assumptions, we projected that over the course of 1 year, the plan would have retained an additional 6,400 members, resulting in $1.1 million in bottom line savings. It is safe to say that retention efforts are a sound investment that not only provides significant savings for health plans, but also ensure continuity of care for Medicaid beneficiaries that rely on their coverage for important preventive care, management of chronic conditions, and life-saving medications. For more information on how Eliza can help you reduce churn in your Medicaid population, visit our website at elizacorp.com or feel free to contact me directly. Thanks for your time today.